So we're going to go ahead and doing the acne treatment. My client here has some acne scarring and some hyperpigmentation from when she was younger and also from pregnancy. So we're going to go ahead and start her facial today. And even though she doesn't have any makeup on, we're still going to go ahead and cleanse the eye and lip area. So we're going to go ahead and do that. And this acne treatment does include high frequency. So I'm going to be using products that are all for acne skin types. So I'm going to be using the clarifying wash and the clarifying toner, as well as the detox clay mask, or you can use a camphor mask. But a clay mask is excellent for people that have acne. Okay, so like I said, this does include a peel, so we are definitely cleansing the eye and lip because she may have some oil or makeup, dirt, debris on the skin, on the face. Okay, we're going to do our first cleanse with the clarifying wash. And we always cleanse the décolleté as well, because while the mask is on, you massage the décolleté. And so we want to make sure we're cleansing the entire face and neck décolleté. So this is going to degrease the skin, remove any makeup. So our first 2 steps is to thoroughly cleanse the face, neck, and décolleté. And we will do a second cleanse because degreasing the skin before a peel is very important. When you're using the clarifying wash, you just need about a pea size or 2 pea sizes worth of product, because a little bit goes a long way. Once I'm finished the cleansing, I will degrease with the toner. The clarifying toner has witch hazel in it, which is a great degreaser. You could also use alcohol to degrease the skin. Also, when you're doing chemical peels, you can use a fan to help alleviate some of the tingling, burning sensation of the peel. For our services, we wear gloves from the beginning to the end of the service. This is a great treatment for removing dead skin cells, exfoliating the skin, making your extractions easier. And of course, the oxygen is going to help sanitize the skin and sanitize the area. So we're going to go ahead and remove our cleanse, and then we will go and degrease the skin. Anytime you feel like the skin is too moist, go ahead and block the skin just by taking a tissue corner to corner, just big bold movements to remove excess moisture. You never want product or moisture dripping down the client's neck or in the client's eyes, nose, or mouth. Okay, so I'm going to go ahead and take a little 2x2 and take my clarifying toner, saturate the middle of the gauze. And we do include the neck with the emerald peel. A first-time client, leave the peel on for 1 minute, building them up to 3 minutes every time they come. For acne, great products for them to be on in the line, of course, is the Mandelic Serum, which they can use at nighttime. And then they can also use Oil Control Complex, and of course the clarifying wash and the clarifying toner. All right, I'm going to use some Vaseline or some petroleum jelly to just occlude the mucous membranes. If there's any open lesions on the face, then this would be a contraindication. So I'm going to take some of the Vaseline, take some Q-tips, and we will put them in the areas that we don't want the peel. So if the client had a mole or a small scab, you could use some Vaseline. If your client has a lot of scabs on her face, then this would be a contraindication. Okay, so because we include the neck, it will be about 12 pumps of the peel. I like to have my client's head slightly raised, and you can use a fan. So I go ahead and saturate my glycolic Q-tip, and I like to do the face in quadrants, kind of massage this into the follicle. It is an AHA neutralized by water, and I move very quickly, getting it into the skin. I ask my client 1 to 10, 1 being the least, 10 being the most, what is the sensation that you're feeling?
1.
A 1. Okay, great. And remember, this is the first time I'm seeing this client for the service, so we're going to just keep it on the skin for 1 minute. I'm going to use cold water to neutralize the peel. You can put ice in the water, but you never want to put ice directly on the skin. Our end point with the AHA peel is, of course, we are looking for erythema. So that is your end point. If your client reaches a 6, you want to remove it immediately. I'm also looking for any hot spots on the skin. What number you are?
Still a 1.
Still a 1. Well, that's awesome. Okay, so you've had peels before.
Yes.
So her skin has a tolerance for the peel, but I'm still going to give it 1 minute. And then I'm going to take cold water with acidic wipes and neutralize. Remember, it can take 15 to 30 minutes to neutralize a peel if the client has a lot of activity. And water does generally reactivate the peel. But when you neutralize the peel, I want you to make sure that your client reaches a 0. What number you're at now?
A 2.
2. So great. So it's staying, it raised a little bit, but being a 1 or a 2, that's something we don't have to worry about. And never leave the treatment room when you have a peel on the client's face, because your client could jump up, scratch your face, rub her eyes. So you have to monitor the client's skin at all times. So now I'm going to take cold water and my 4x4 compressors, and I'm going to just gently press this on the skin. You never ice directly on the face, but you can put some cubes of ice in the water if you want to. And when you neutralize a peel, the peel can reactivate, so it may have a little burst of tingling. That's okay, just to let your client know it's normal. And you're going to continue to do cold compresses until you are at a 0. Do you feel tingling anywhere?
My forehead and my jawline.
Okay. So sometimes when they tell me about a specific area that's still tingling, what I can do is take my aesthetic white that's saturated, open it up, just kind of press that on there for a little bit. That kind of helps cool it down. And then we just continue to neutralize. Like I said, it may take some time to neutralize. Alpha hydroxy acids are corrosive. They tend to continue to work, and you want to make sure that your client is at a 0. So we will continue to neutralize, and then we will go ahead and start the oxygen cream and activator. The oxygen cream and activator stays on for 5 minutes. You feel it tingling anywhere?
No.
Okay, so even though my client says no, guess what? I'm going to go ahead and neutralize her skin again just to make sure, because again, I can't feel. I am looking at her skin. Her skin looks it's slightly pink, which is fine. Nice activity there. And remember, with the emerald peel, start with 1 minute and time that minute. But if your client reaches a 6 even at a minute, then you want to make sure that you go ahead and neutralize immediately. Okay, we're going to go ahead and start with the oxygen now. So I'm going to take my oxygen cream, and we're going to massage this onto the face. The catalase enzyme activates the oxygen to create a burst of oxygen on the skin. And then I will take 3 sheets of plastic and apply it to the skin. And this will basically occlude the oxygen onto the skin. You leave that on for 5 minutes. Never cover the eyes, nose, or mouth with the plastic. Allow the client to breathe. So the eyes, the nose, and the mouth must be uncovered. That'll stay on for 5 minutes. You can massage the hands and arms during this time, or you can just wait and write on your chart. And I would just remove this with room temperature water. So we're going to go ahead and remove that plastic wrap. So post-care for this service is, of course, stay out of the sun and no exfoliation, mechanical or chemical exfoliation for 7 days to 2 weeks. No tanning beds, no hot showers, exercise. I wouldn't exercise for 24 hours because she did have a chemical peel. Makeup, she can wear some mineral makeup. Otherwise, I would wait 48 hours because we want the skin is fresh and clean and beautiful. We don't want to clog the pore with any comedogenic type ingredients. Also, we want to make sure that whatever product she's using does not have fragrances or chemicals in that can irritate the skin post a chemical peel. This is when you would perform the extractions in this portion of the treatment. So you would go ahead and dry the skin. And you would then perform the extractions. We're going to move now into our high frequency. Do you have any metal pins or plates in your body?
No.
Okay. So I'm going to be using this gauze over her face because that's going to create a gap between the electrode and the client. This is great post extractions to reduce inflammation and also it has an antibacterial effect. I always turn it on, touch the so that the client can hear the buzzing noise and also it can kind of self-sanitize their mushroom, even though I've cleaned it beforehand. And I'm going to make sure also I turn it down, touch it, and then touch the client. And then wherever you've done extractions, you can move the mushroom over the areas that you've done extractions. If somebody has a combination skin, then you only need to do this in the T-zone. The reason we like to place a gauze either on the electrode or on the skin is so that there is a gap between the electrode and the skin for it to create that ozone to kill bacteria on the skin. And then when you're ready to lift up, you can just touch it and lift up and turn it off. At this time, you would choose a mask, tone the skin with the clarifying toner, and then you would apply a clay mask, massage the décolleté and hands if you didn't do so already, and then you would conclude the facial with your SPF and recommend home care and remind your client of post care.